Assalamualaikum friends. Today we will study about allergy. What is meant by the word allergy? What are the preventions for the allergy and what are the treatments of allergy? So first of all we will have to go through the term what is meant by allergy. So the allergy means hypersensitivity of the immune system. We know that there is an immune system inside our body which is responsible for our protection from infectious particles like bacteria, viruses, etc. But in allergic persons, there is hypersensitivity and hyperactivity of the immune system, that the immune system becomes even sensitive to the non-infectious particles like pollens, etc. And the antibody responsible for allergy is IgE antibody, which is also called reagent. IgE antibody is present in large amount in the patients with allergy. This type of antibody is responsible for allergic reactions, and when this is present in large amount, the immune system become highly active to even non-infectious particle, which is termed as allergen. So allergy is basically a non-ordinary response of the immune system, and it is genetically passed from parents to offsprings. Means that allergy runs in families. But allergy can also be environmental, that we can become sensitive to a particular agent even when we are not properly exposed to that in our early developmental stages. So allergy is basically hypersensitivity of the immune system, and the agents responsible for allergy are called the allergens. The allergy occurs in allergic patients in which IgE antibodies are present in large amount, and this is also termed as atopic allergy. Now, what are the type of antibodies responsible for allergy? We have read that the immunoglobulin E type antibodies are responsible for allergy. There are 5 types of antibodies inside our body, one of which is IgE, which is responsible for allergy. We know that there are helper cells, T helper cells inside our body. The type 2 T helper cells produces the B cells, which then produces the IgE or immunoglobulin E. Then the immunoglobulin E binds to the surface of basophil and mast cells. As you can see, this is a basophil or considered a mast cell. The IgE antibody is present on the surface of the mast cell or basophil. Basophil are present in bloodstream while the mast cells are present in our tissues. So IgE antibody, after its formation from T helper type 2 cells, binds to the surface of the mast cells or basophil. Now suppose an allergen comes inside the body. This allergen will bind to the IgE antibody, which in turn causes the rupturing of the IgE of the mast cell or basophil. When there is rupture of mast cell or basophil, there is release of certain substances which causes the allergic reactions. These substances include the prostaglandins, histamines, leukotrienes, which is also termed as slow-reacting substances of anaphylaxis. Then the eosinophilic chemotactic substances and neutrophilic chemotactic substances. All these substances released in response to the allergen reaction causes the vasodilation. First of all, vasodilation. Histamine is usually specific for vasodilation. Then when there is vasodilation, there will be increased permeability of capillaries. Also the contraction of smooth muscles like bronchospasm, mucus secretion, and stimulation of sensory nerves. When there is stimulation of sensory nerve, there will be the itching. Bronchospasm means that contraction of the smooth muscles of the bronchus, and abdominal cramps or vomiting time. So this allergic response can also be acute and can also be delayed. The acute response occurs within less than 1 hour, while that late response is usually due to eosinophils or other inflammatory cells. So how to prevent allergy? if we are exposed to a particular allergen during our early stage, during our early period of life, then there will be the suppression of the T helper 2 cells, which are responsible for production of IgE. When there will be less IgE, there will be no allergy. So this hypothesis is called hygiene hypothesis, and it can be seen that allergy is mostly usual in the cleaner countries rather than the polluted countries. To test that towards which allergen you are allergic, we perform the blood test, in which we give the allergen from outside to the body through the pricking, through pricking in the skin, and see the reactions that to which you are or we are allergic. Now comes towards the treatments. Before treatments, there should be prevention. The prevention of the specific allergen to which you are allergic. We should avoid the allergen to which we are allergic. This is prevention. Now, if we are not able to do so, then there are other treatments. When we are passing through the allergy, there we can give the patients the antihistamines. Antihistamines will cause the contraction of blood vessels. The blood vessels which are dilated due to histamines, antihistamines will cause the contraction of that blood vessels. Other therapy includes the corticosteroids and mast cell stabilizers, that there will be no rupturing of mast cell and mast cell will be stabilized and no release of these substances which causes allergy. And last comes immunotherapy. Immunotherapy means giving the doses of specific allergen to which you are allergic in small doses, then in large, then in larger, and then in largest dose. This will cause the depression of your immune system towards that particular allergen which we are giving to you. So this is the immunotherapy. All the discussion was about allergy, and there can be acute response or late response. Acute response occurs in less than 1 hour. And what is allergy, what are the preventions, what are the bases, and what are the treatments of allergy. Hope you will understand it. Thank you.